Hello. In this video, we will be diving into Virtual Visits 2.0 and what CHR virtual visits look like within Pathways. You are likely curious about what Virtual Visits 2.0 is and what it means for your clinic. In this video, we will be walking through the key features available with Virtual Visits 2.0 to enhance your clinic's virtual visit experience, as well as the suggested workflows available upon moving to the Pathways virtual visit platform. First, let's review some of the key features available within Virtual Visits 2.0. Number one is having Pathways as an organized view and home for your virtual visits. This really enables your clinic to be able to easily track a patient's progress throughout their visit with the ability to track when a patient is waiting for care, being seen, or if there are key follow-up items awaiting to be actioned after a visit. Additionally, Pathways enables clinics to have clear insights into a virtual waiting room and manage your queue of virtual appointments in a central location. Next, we're able to update appointments directly from your visit within a patient's chart without needing to navigate to the schedule, simply marking a patient as no-show, canceled, or being seen all directly from within the visit while simultaneously updating your schedule without needing to leave the patient's chart. Next, we're able to assign and track staff and patient actions. Leveraging patient tasks, providers can easily have patients complete tasks such as watching an educational video or uploading an image direct to their patient file before providers even seeing the patient. Fourth, we're able to conduct virtual visits as you've seen in Virtual Visit 1.0 directly in the chart with integrated task assignment and chat. So you're easily able to communicate with your patients and assign them tasks as they are waiting to be seen or while you're seeing the patient. Next, we're able to track patient pathway chat history so you can refer back to chat histories directly in the patient chart at any point in the future. Additionally, we are able to create and conduct virtual visits on the fly using Pathways, and no longer do you require a scheduled booking to conduct a virtual visit. If you need to create one on the fly, simply add it to Pathways and send the patient their virtual visit link, and you'll be able to start the visit immediately. Finally, with analytics and with those clinics who have analytics enabled, we'll be able to track and report on new outcomes through analytics. Track outcomes such as average time in each phase, tags assigned, and total patients in each location using Pathways. Now that we have a good idea of some of the key features available within Virtual Visits 2.0 through Pathways, let's confirm some things that are not changing with the Virtual Visit platform. So, two key things to keep in mind throughout this transition is that you will continue to be able to conduct virtual visits seamlessly from within the patient chart as you were able to do so in Virtual Visits 1.0. Secondly, you will continue to see active and upcoming virtual visits and other pathway entries directly within the patient chart to the left-hand side. Now that we've gone through the key features to consider when moving to Virtual Visits 2.0, as well as the items which are remaining consistent with the 2.0 delivery of virtual visits, let's dive into what the virtual visit workflow looks like when we have Pathways enabled and Virtual Visits 2.0 is active within the domain. As we can see, the schedule looks very similar to as if we had Virtual Visit 1.0. When I click on the visit, I can see that it's virtual because of the camera icon in the top left-hand corner. I can also see this by the highlighted Virtual Visit tab within the appointment booking. You'll notice the only difference in this screen is really that there is no virtual visit code available within the booking screen, which is all going to be facilitated within Pathways itself. All the other information will remain the same within the appointment booking window, such as the appointment time, patient, provider, appointment type, status, presenting issue, and so forth. When booking a new appointment for Virtual Visits 2.0, simply click on the schedule as you normally would and select Virtual Visit. You'll notice that this will let us know that the virtual visit invitation will be sent automatically 5 minutes prior to an appointment booking. From here, the rest is as appointment booking as you know it, by selecting the patient, appointment type, and appropriate presenting issue. All of this information will then flow into Pathways and allow you to conduct your virtual visit directly within Pathways and within the patient's chart once it's flown in 5 minutes prior to a patient's appointment. We'll go ahead and look at Josh Smith's appointment. We can see that Josh Smith still has action required, but they have a virtual visit. Now let's go see what these visits look like within Pathways. Pathways is a new icon that you'll see within the left-hand menu on your CHR. It is a house icon at the very top of your CHR tab menu. When selecting Pathways, we will be brought to a new screen, which is a Kanban style board where we're able to organize all of our visits, virtual or physical. You can see that by default we have pre-visit, visit, and post-visit columns. Each of these columns is named a phase within Pathways. You'll notice that we only see Brendan Smith available as a visit, even though we had Josh Smith booked as well. Virtual visits will only come into Pathways in one of three ways. They will come in either when a patient has booked in to their virtual visit, meaning that the patient has logged into their virtual visit. As you can see, Brendan Smith has, because they have check marks next to their agreement, camera, and microphone. So we can see that this patient checked into their virtual visit and their virtual visit is active and ready to go within the pre-visit section of the pathway. The next way that an appointment may come into Pathways is by the appointment type setting being automatically set up to come into Pathways a set time frame prior to the appointment. For example, I may have all of my consultation appointment types come into my virtual visit pathway 5 minutes before they start their visit. It's important to note with this that this will apply to all visits within your appointment type and not just the virtual visits. So if we're setting that up within settings, it will apply to all. Finally, I can add a patient to virtual or to the pathway manually as well if I would like to. I can simply do this by clicking the plus button at the top. You'll see that I'm able to add without an appointment or add with an appointment. Adding without an appointment allows us to spin up a virtual visit on the fly where I can simply click without an appointment and assign a patient and select the virtual visit option, and then I'm able to conduct my virtual visit. For this example, we'll continue to use Josh Smith as my patient that I'm wanting to see and pull into Pathways. I'll select with appointment, and I'll be able to see Josh Smith's appointment within the visit screen and select to pre-visit. Again, this is not a likely flow because the patient would have already signed in and would have been populated within Pathways, or I would have the settings set up under my scheduling settings to have the appointment type pull into Pathways an automated set time prior to my appointment booking. As we can see, the key difference between the two appointments for Brendan Smith and Josh Smith is that we're able to easily identify which patients have checked in for their virtual visit appointments versus which patients have not yet checked in. We also have the opportunity for those patients who have not yet checked into their virtual visit appointment to send them an invitation or remind them of their appointment. So let's do this with Josh. Here it'll display their preferred contact information, and I can invite from here. As well, within the virtual visit ticket, I will see a variety of information. I'll see the patient's name, I will see the presenting issue that they were booked with, as well as I'll see any staff actions and patient actions that have been assigned or completed, and we'll go through these shortly. And finally, I'll see when the appointment was booked at, the state of the appointment or the status, and who the appointment was booked with. Finally, in the top right corner, I'll see how long a patient has been waiting in here. We can see that Brendan Smith has been waiting in pre-visit for roughly 40 minutes, whereas Josh Smith has only been in here for about a minute and a half. Let's go ahead and move into our visit itself for Brendan Smith, and we'll take them out of the virtual waiting room, which is this pre-visit phase, and move them into our visit. Simply, to open up the virtual visit, I can simply click on the visit itself, and it will bring me directly into the patient's chart. As well, if I am already in the patient's chart, any active pathways I will see under the Pathways tab, similar to what I would have seen in the Virtual Visits tab for Virtual Visits 1.0. Within here, I'll see a variety of items, including the status of the patient being checked in and my ability to start a video chat, as well as chat functionality and assigning of tasks. Now that I'm ready to see this patient and move them to the visit phase of their visit, we'll move them from pre-visit to visit. If the patient no-showed or canceled their visit last minute, I can also choose either of these options, and it will automatically remove the patient from the pathway and update the status of their appointment appropriately. For this patient, we'll say that we are moving them forward to their visit. At this point, I would be able to start my encounter, which is automatically linked within my virtual visit pathway ticket. Here, I can also choose to send any chat and just let the patient know that I'll be a few more minutes. This will automatically send to the patient for the patient to be able to see. While the patient is waiting, I can also assign a variety of tasks as well. For this example, I may be seeing a patient for a rash and I want them to upload a picture. I can simply ask them to upload a picture by assigning a task of uploading picture, and let's get them to also watch an educational video. Once I've assigned these tasks, the patient will receive them in their virtual visit and be able to complete them on their end. I can continue to work through my encounter as I normally would and start my video chat once I'm ready to see with the patient. Once I've completed the visit, or if I have any additional tasks to assign, I can do so. Staff tasks can be easily assigned within the visit and are typically going to just be a checklist item of whether we've done it or not, and I can assign it myself here. To mark things as completed, we can check them off here, and they will be marked as completed automatically. As soon as a patient completes any patient task, it'll be marked as completed automatically. However, I can also manually check them off as well if I need to. Finally, we have assigned tags that we can have. Here we can put specific tags, say that I want to highlight a specific room, or I want to highlight a specific aspect for this patient, perhaps book in 2 weeks as an assigned tag. All of the assigned tags will be available and be able to be seen within the virtual visit ticket in the Pathways screen. Finally, once I've finished my visit, finished my encounter, and ready to move forward, I can either complete the visit or I can move this patient to post-visit. Completing the visit means that this patient will be removed from Pathways and this visit is completed. It'll also update the appointment status to complete as well. Moving a patient to post-visit will move them to the post-visit phase of Pathways, which is that last column within the Pathways that you would have seen. Typically, post-visit is used when there are specific actions that we want to be completed after a visit has been completed. Perhaps we want the patient to be booked for a 2-week follow-up, or we want certain things to be completed after the visit that we can't get to while we are conducting other visits simultaneously. So this can remain within post-visit until we've completed those tasks. Finally, once we've completed any additional tasks and we're ready to complete the visit, we can select the transition of complete visit, and it will move the patient out of Pathways and complete their appointment. And we can see now only Josh Smith is available within Pathways. As I mentioned, there are some other items that you can do within Pathways, such as creating a virtual visit on the fly, where we're able to create a visit without an appointment, assign a patient, select that this is a virtual visit, and select our presenting issue, and move them to pre-visit and send out their invitation. This will send a patient's invitation to virtual visits, and we'll be able to immediately track when the patient has signed in through their status within Pathways. Finally, You'll notice that there are common filters that you can filter from up here, where we're able to filter to specific appointment providers or primary practitioners, as well as limit the contents that I'm seeing within each pathway ticket. I can choose that perhaps some items are not so relevant to myself, so I don't need to see information around task summaries or important patient tasks. And I can click save, and those will remove those items from my pathway tickets so that they aren't cluttering my view of what's important to me. Finally, if I click the plus virtual, it will show me all visits that are associated with the location I'm filtered to, as well as my virtual visit appointments. And finally, we have the Only My Patients tab, which is commonly used by providers so that you're only seeing patients which are booked with yourself within the schedule, and you aren't seeing appointments booked with other providers that may not be relevant to you to track within the Pathways tab of your CHR. This is a small glimpse and gives you an idea of what's available through Pathways to facilitate and enhance your virtual visit experience in the CHR. Virtual Visits 2.0 is the CHR's main focus when it comes to virtual visits, and based on this, you can expect more development and focus on the enhancement of virtual visits through 2.0 through Pathways, which will include exciting features such as virtual visit group visits with multiple providers and one patient, and future interlock with exciting patient app features. If you have more questions on virtual visits and what can be learned about CHR virtual visits and pathways, be sure to head over to the CHR Help Center, where we have over 15 help articles on different functionality available for CHR pathways and virtual visits 2.0. Thank you for watching this video.